Repair the RPD. The need to repair the RPD will occasionally arise. Many situations can be avoided by careful planning. Occasionally repairs can be anticipated to increase the service life of the RPD. The patient should be educated on proper placement and removal of the RPD, as well as meticulous oral hygiene and regular recall visits. Broken clasps. There are several reasons for broken clasps. Repeated flexure into an excessive undercut. Too much undercut may damage the tooth and clasp over a period of time. Structural failure of the clasp arm. This may be due to design or manufacturing errors, such as overheating during soldering of wrought wire. It also may be from repeated or excessive adjustment of the clasp. Patients may use the clasps for removing the RPD. They should be advised against this maneuver. Careless handling and patient home remedies may cause breakage. Fractured rests. Fractured rests may occur, usually at the marginal ridge. Improperly formed rest seats are usually the cause. Excessive occlusal adjustment is also a frequent cause of rest fracture. These failures generally may not be repaired. One may consult with a dental laboratory regarding such an endeavor. Weakening of components due to grinding to relieve tissue impingement. It is essential to avoid such with proper diagnosis and design, as larger connectors generally cannot be repaired. Loss of tooth not involved in support or retention. These can be replaced with artificial substitutes, depending on the design of the partial denture. Loss of artificial teeth. These may be reattached or replaced. Loss of abutment teeth. In this case, the next tooth adjacent is made the primary abutment, and may require placement of a raw clasp as a temporary measure. It may be necessary to remake the RPD. The ability to repair the partial denture must ultimately be determined by the person actually tasked with doing the repair. It is usually wise to consult with a dental laboratory technician as to whether or not the RPD may be repaired, and what is needed to facilitate the repair. Occasionally repairs are facilitated by making a pickup impression, that is, an impression taken with the RPD in the mouth, with the impression and RPD poured in dental plaster. The RPD may then be repaired, separated from the stone and reinserted. Assigned laboratory work authorization is required. It is generally a good idea to try the RPD in the patient's mouth, prior to attempting a repair.